No, I like that idea too for the title because there's a lot of things that we're
The phobic one.
yeah, that we have phobias of.
Phobia file. I like that too. Because, I mean, it's just on point.
And I feel like that's gonna be mostly what we would be talking about anyways, things that,
We don't.
we don't like,
Yeah, exactly.
because that's what brings people
Like,
together, really.
we don't like ill people. We like wellness. We don't like fat people. We like skinny.
And
We
the
don't
list
like
goes on.
ugly.
We don't like
We
ugly.
don't like losers. We don't like poor people.
It's like that meme that's it's what are the 2 things that you're most scared of in life? And people are like sharks and burning alive.
Yeah,
And it's
yeah.
mine is being poor and slash or fat. Those
Burning
would
alive.
be I'm like burning alive. But then at least I wouldn't have to endure being poor or fat. At least it would be over.
Oh my god.
You know what I mean?
What a comparison. Yeah. No, I agree. Bad food. We're phobias to everything that is not good. We're accustomed to a certain kind of living.
Exactly. And that's what happens when you move to South Florida.
Yeah.
It changes you.
And you have common sense. And you're not a liberal.
No, exactly. I feel like everybody who I've ever heard on a podcast talk about podcasting is basically like, it's gonna be really shitty in the beginning and you don't understand about quality of the microphone
Yeah.
and stuff, but it's you know what I mean? What are we gonna do?
Exactly.
I'm not
Starting
technologically
We're starting somewhere.
exactly, and technology is not my
Oh, we're recording right now.
yeah, it's not like my favorite
Honestly, a
thing to
lot
deal
of
with.
this stuff we can like use because I feel like this conversation.
So should we talk about who we are and why we're doing this?
Yeah. Yeah.
Okay, so who
First.
are you? Oh.
Oh.
Okay, I'll go first. My name is Grace, and my friend here, Taylor, we work together. And sometimes at work, we have a problem of focusing
Mhm.
at work. And
We work hard, then play hard.
also, hey, guess what? I don't want to work. I mean, okay, that's not true. I love working. I just don't want to have to be at work. So here's the reason we're here. Is because if I get out of bed on a Monday morning, Tuesday morning, could be any morning that I'm supposed to be at work, and I see it's sunny and 75 and the ocean clear,
Just
crystal
you
clear.
hear it
I can hear the crystal clarity of the ocean, and I drive past a coffee shop. I shouldn't have to go to
Your
work.
car literally
Is-
telling you, Papa Quads.
Papa Quads, take it right. And I don't want to have to be at work thinking about those things. So for me, that's my why.
Ditto.
Also, love to hear the sound of my own voice.
Okay, ditto again. Yeah, that's also my why. And I believe, I mean, we have all of our phobias, and like, how can one work 40 hours a week? Which we do.
Yeah, that's
we
crazy.
do
More.
work,
More.
and we still maintain all of our hotness, health, wellness, social life. We do it all. We do. But we want to be wives and we want to be moms.
And I don't want to have to do anything.
Exactly.
That's my problem. Can I do everything? Of course. Easily. Could do it. Am doing it currently. I don't want to have to.
Exactly.
And I think
Freedom.
that's important.
Yeah.
That's important to talk about. And I think we have a lot of things to say that other people are thinking and they're not saying. And I think it's important to say it.
Yeah. I'm not going to be politically correct. I'm not going to say identify. Well, there are issues in the world that need addressed. So we're
The biggest issue, I think, in the entire world right now, hot take, is blood sugar.
yeah, 100%.
And I think that if this podcast was able to tackle that alone, there would be no more, I mean, almost pretty much anything.
Yeah.
There would be no problems.
No, I agree. I agree.
I think that's the root of pretty much every single problem I've ever thought of, I've ever had.
I tell that to all the clients. Fix your blood sugar.
And you have parasites.
99% of your problems. But you know what? The parasites are causing the blood sugar issues. So
No, my favorite,
so deworm yourself. That's the
right.
biggest take.
No, my favorite conversation that I've ever heard you hear with a client, or that I've ever heard you have with a client, was they were something about their red blood cells were low, and you said the parasites are eating them.
Yeah.
You're like, you look at her deadpan, the parasites are eating them.
Yes. And she looks at me and she said, I don't have parasites.
Wait, who was it?
She was mean to me.
Yeah,
Wait,
but what client was it?
I know she doesn't come in often. The one wait, there's probably multiple of these because
I'm thinking of the red blood cell
the
one.
one situation, I don't think you were there. It was when I had an issue and you called me and I was like, I about started crying at work because
Oh, yeah.
I was so mean to me.
Okay, I remember that.
And she
She was the nurse.
specifically yes, no,
No,
she
she
wasn't a
wasn't a
nurse. She
nurse.
worked okay.
No.
Typical,
Oh, no.
typical. I work in healthcare, but doesn't say what they do, thinks they're God,
No, of
but is
course.
actually just not bashing any like aides, techs, or like rad techs or whatever they're freaking called.
They're important.
Yeah, they're all important. But to come into my workplace, ask me a specific question of why I'm anemic, and I give you the answer.
Because she asked
Why?
you.
Yes, why you're probably anemic. And I tell you because a lot of people have parasites. If you have animals, if you walk barefoot, if you eat sushi, if you eat
Yeah.
any type of red meat, like all the things. And she just scoffs at me and is like, I don't have that.
Okay, then why'd you ask?
I'm done. I'm done here. You don't have parasites. You're just anemic. That's just, that's just how God made you.
And see where that gets you. See how many problems that's going to solve.
And by the way, anemia is a symptom, not a diagnosis. Same with anxiety, a symptom, not a diagnosis. Depression, symptom, not a diagnosis.
And you know what? If they controlled their blood sugar and they moved to South Florida, no one would have any of these things.
And if you stopped being fat, which would come with a blood sugar,
Right.
take care of yourself. It all just kind of plays into place. But people are they let their blood sugar control them. They gain weight. They become depressed. They become anxious. And then they're mean to people. So it's just a circle of
Yeah.
unhealth,
Yeah. And then we have sort of problems. It's when clients ask me stuff like that, and then I tell them I'm the same thing. I tell them the answer, and then they get mad. I'm like, okay, so
Smart.
we're not even solution oriented here.
Well, it's they just want us to be like, take some Tylenol, fix all your problems. They just want a quick fix. And it's like, we're not going to do that. I'm not going to lie to you. That's not loving. I'm not going to lie to you.
No, I would never lie to them. No, never. They should get on, and that's the other thing. They should just be spending, more money on it. And
Yeah. We're just
funding my
different.
lifestyle.
I'm going to be so honest with you. If you want liars, go to your doctor.
And you know what? All of the doctors are liars.
They
No,
don't, and
no,
you know what?
they aren't.
They don't know what they don't know.
They
So
don't.
you have to give them a little bit of the benefit of the doubt.
And with my recent medical situations, I have learned doctors are right about some things because I'm the same. I'm like, I'm not only am I smarter than you, but also I don't even know why you went to school. You don't know anything.
And
So
here's
it's
the
like
thing.
I'm only here because I absolutely have to be.
Mhm. Because you need an order a lot of times. I need an order for blood work. I need an order for whatever. There is a time and a place for Western medicine. Absolutely. I'm not telling people to not ever, seek a doctor, but they aren't root cause oriented. They're just like, let's just mask it with something because that's what they're taught. I mean, going to nursing school, it's all medication, medication, medication. You have this symptom. I'm going to give you this. So, you know,
Right. But so in my specific case, I was born without a tooth. And that was not really something actually actually, there was a suggested solution from another client of ours. Fuck, what is her name? The blonde, not the blonde who, shows you the pictures of the aliens.
oh, Misty.
Misty. Okay, Misty came
Shout
in.
out Misty.
Hey, girl. So Misty's like, I tell her about my tooth, and she had the veneers that broke, that snapped, remember? And I was telling her about how I need a tooth, and she said, "So go get a tooth seed." And I said, "What's a tooth seed?
Yeah.
Do you know what the tooth seeds
Does
and the med beds?"
yes, I know about the med beds.
Yeah, it grows. So she's like, "So
Mhm.
all you have to do is go get the tooth seed." And I was like, Awesome. Where the fuck is the tooth?" She goes, "Well, I don't know if you're able to get it." And I said, "Again? Not solution oriented. Get out of my face immediately." No, I was like, "Okay, great." So I had to go get an implant, and then he sort of suggested follow the protocols for the implant. I said,
I'm not gonna
"Eh.
take
I'm not
antibiotics.
doing that." He also told me not to drink through a straw, not to smoke. None of it happened.
Well, you didn't smoke.
Well, I don't know. So I smoke weed when I can't go to sleep
Oh, that's
because
true.
here's my thing.
Yeah,
Which one's worse? Not sleeping because you drank
not
alcohol,
sleeping.
or you have crippling anxiety because of work tomorrow, or smoking weed and sleeping? Like,
I
obviously,
didn't even
I'm
think about smoking weed. I thought I was just thinking nicotine.
oh, ew, I don't smoke
I
nicotine.
know exactly.
That's
That's
disgusting.
why
Vape? Disgusting. I would never. No, I don't remember if I did that or not, but he did tell me to take the antibiotics. I said, "No, sir, I won't be doing that."
But you did
Take the oil of
oil of
oregano
oregano,
for 6
which is
days.
actually a better natural antibiotic.
Yeah, so anyway, my implant failed though, so that's just,
But I think that was his fault.
So well, okay, so
We won't name
when
names,
I
but
when I consulted my secondary opinion doctor, who is a close friend of primary doctor in a very professional setting, might I add, I had my
Mhm.
consultation. He said that the implant can get coated with bacteria, and then the second it goes in, and it could fail and da da da, and I should have done some sort of mouthwash. And I said to my primary doctor,
Why didn't you tell
I
me
said,
that?
"Do you know about the mouthwash? You didn't tell me about the mouthwash, and you drilled into my face." And he said, "All the doctors have different
So it
methodologies.
was
They have
his
different
fault.
training."
It's his fault.
Well, my theory is like my body's too pure
Mhm.
to accept a foreign substance into it.
Exactly. So to reject.
Yes, but I do need it to accept an implant. I don't want to be toothless forever.
And so I think if we speak over your
I
body,
need to pray.
yes, you need to like in your mind accept it.
No, exactly. And I didn't that I wasn't in my mind not accepting it, but I was super anxious. But I mean, someone you don't know taking a drill and slicing open your mouth and then drilling into your face, it's scary.
Slight
And you know what the doctor also said to me? He said, "I wish you would have," I'm paraphrasing. He said, "I wish you would have shut the hell up during the surgery and stopped asking so many questions." And I was like, "That's crazy because I was awake for a surgery. What am I supposed to do?" And then he starts telling me like, "I wish I IV sedated everybody so they wouldn't be awake during their surgeries." And I was like, "You know what? I actually that's so valid." Because I've had other surgeries like my ACL and my femur or whatever that I had to have reconstructed. I didn't reconstruct my femur, just an ACL, but I had a separate surgery about the femur. It was fine. If I was awake during that, I would have said, "What are you doing? What are you doing? What are you," like I would have been
Yeah.
like such a problem. So I do feel bad for some dentists. And honestly,
Shout out Dennis.
honestly I understand
We
why.
love you.
No, now I love oral health.
Yeah.
But one of my friends actually was telling me she does coconut pulling.
Yeah.
Do you do
Oil
that in
pulling.
your mouth?
Yeah. I haven't done it for a minute, but
What do you
yes.
do? You like
You
you
swish oil.
microwave the oil?
I just take coconut oil and swish it in my mouth.
Like you warm it up,
For yeah, it
like in your
melts so
mouth?
quickly. Yeah.
Yeah.
And then probably like 15-20 minutes, and then I
Oh,
spit it out. Yeah.
that's kind of a long
It is
time.
a long time.
Before or after you brush your teeth.
I brush my teeth and then I swish it, and then
And
I
what
do
does it
my
do?
mouth. It's supposed to draw like bacteria and impurities and I think whiten everything. It's very antibacterial and at least from what I know.
Okay, maybe I'll try that.
A lot of dentists will say it's
Bad for you?
complete BS, but
Okay, wait. I always get worried like when the lines are like smaller. It's like, can they hear us? Like, do you see how sometimes the lines are like smaller and then some
Mhm.
you see like they're really small?
Yeah,
But then if I talk loud, but I turn the mic of it like all the way up, so I feel like it's totally fine.
that'll probably be fine.
Um, yeah, well, that's because they're from their schooling or
Exactly.
whatever.
Yeah, a dentist once well, the last dentist I went to, he told me that, he was so proud because his cortisol was super low.
Oh, so he knows about you. Oh, so he knows you well.
Yes, so I was like
How does he know that? Did he do spit testing or whatever?
he just told me that he had blood work and he tested his
Oh,
hormones and
okay.
he was just so excited that his cortisol was really low, and I was like, "You know, cortisol isn't good to be super high or super low." So, that's a problem, and also he looked super unhealthy, was very
Wait,
overweight.
how did he get his How did he tell you that he lowered his cortisol?
He didn't lower his cortisol. He just said, like, when he tested it, it was low. And I'm like, "That's not good. That's where your
No.
metabolism, your adrenals are struggling."
Oh.
But he was trying to tell me that my charcoal toothpaste with minerals and my oil pulling wasn't helping. And
You
I
said, "Hey, have you looked in the mirror recently?"
really, yes. Okay, let's, look at the difference here. And then, yeah, he, was just super on me about all of my because I hadn't been to the dentist in probably 2 years at that
Oh,
point,
that's bad.
and he was kind of, he was pushing the fluoride, and he wanted me to do
X-rays.
an X-rays, and I didn't want to. I just wanted my teeth cleaned, and then he already went into it thinking, "Okay, this girl's gonna have cavities, this girl's gonna" then she cleans my teeth, and everything is literally spotless. I did the, X-rays, and he's like, "Yeah, everything looks good. I'm really impressed." I was like, "Yeah, thank you."
I'm surprised he even talked to you that much because usually dentists don't, like, give a shit about you, honestly.
Oh, it was,
Family
well,
friends or
the
something?
no, not at all. It was random.
Oh,
Randomly went to the
really?
dentist. But
In
the
Ohio?
yeah. But the girl cleaning my teeth, she was asking me all the health and wellness questions because she was struggling with her weight, her metabolism,
Oh, nice.
acne, all the things,
Yeah,
hormones, and, yeah. So and I was kinda being a little problem patient. So I
they hate
think they were
that.
like, "Bring the dentist in, let him talk to her." Had a little bit of pushback,
And
but
here's the thing, you thought the dentist was stupider than the
yeah.
hygienist, so it actually probably backfired, like, they shouldn't have brought him in.
It was honestly just, yeah, a whole problem, and I'm like, "I'm smarter than both of you. Just clean my teeth and get me out of here."
And
And
then you were
then
like, "Fuck the dentist, I'm buying my
yes,
own tools."
truly, yes, then I bought my own tools, but on it's so funny because you go to these dentist office, and on the way out, they give me a cookie.
Really? I've never
Yeah,
had that.
I've
They
had
always
that
give me,
multiple
like, the
times
little
now. They
brush,
give me that too,
which
but they gave me a
obviously makes
cookie,
sense.
a fresh one, it was delicious. But
Wait,
but
wait, did someone bake them that day and
I
bring them
assume
in?
they
Well,
baked it
maybe it
beforehand.
was one of the front desk staff made cookies and brought
No,
them in that
it's
day.
all the time.
Interesting.
Yeah.
So they it's their method to get you back
Genius.
in, give you
Genius.
cavities. Yeah, it's genius.
Yeah. It would
And
be
that's what's
like
wrong with the entire world. Like, if you could put
yes,
it into a
you
nutshell, it's the
create the problem
cookies.
and then you have the solution to the problem. So it'd be like if we were just giving people espresso shots every morning and giving them just carbs on carbs or
Sugar.
yeah, all of the things. And then we're like, we have a solution.
But instead, I tell them 2 for 1, head to yoga joint, get your sauna, get your workout.
Yeah. Yeah. Exactly. And we're
I'm
like, get
I'm
off of birth control right
right
now.
now.
Detox your body, castor oil pack,
No, if
sauna,
we
sauna, sauna.
sauna. If we told everybody at work to get off birth control, which we do,
Yep.
but if they actually did, we would have no staff.
And shout out
We would have no one working
to the people
anymore.
I've told to get off of birth control and gotten pregnant.
You're
You're
welcome.
welcome.
It's literally all of them.
Happy Mother's Day.
It's like 8 people. You
Yes.
keep them in your phone instead of a list of people you slept with, it's a list of people you got pregnant.
Exactly.
You're like, "Oh, yeah,
Yep.
yep,
Yep.
here's the
Whether you
news.
wanted to or not, you are
You're not of
welcome.
a baby."
The light of
And
your life.
that's what I'm always scared of, but here's my 2 options that it kinda came down to. When I was on birth control, I got fat, ugly, miserable, it was a whole thing, and I was like, "Would I rather be fat and ugly forever or just fat when I'm pregnant?"
Exactly. Exactly.
A
Uh,
and I said, "Just when I'm pregnant." I still haven't gotten pregnant, thank you God,
And when you're pregnant, you're glowing too. So
and then you get the gift of obviously a child, and,
yeah.
like, it's a whole thing. Hopefully, you didn't, you know, sleep with
Yeah.
someone who's poor,
Don't pick a loser.
and then you're
Don't
gonna be fine,
pick a loser.
and then everything's honestly great.
Yeah. Everything always works out.
So you're welcome to those people.
You are welcome.
Hopefully, you're enjoying Mother's Day with your 7 kids.
But hey, infertility is a real thing, and, we will talk about that because it's bad, and I feel like Western medicine is just aiding to it. It's just, like, causing it, causing it, causing it, and then there's so many people that walk around and think that they will never have babies, and it's just sad, so and
But here
we're here to
okay,
fix it.
but you know what's funny is, like, the the people I know who have expressed to me well, actually, it's only, like, literally 1 person that I'm thinking of in specific who has expressed to me, "Oh, I'm nervous, I can't get pregnant." The first time they quote unquote tried, I guess. I don't know. I hate using that
Mhm,
language because it's like,
mhm.
okay, it came inside you,
Yeah, yeah, yeah.
right?
Like,
She
the
got pregnant
baby's born.
immediately.
Yeah.
A lot of people are fine
Yeah,
and then they just get pregnant.
yeah.
So that's what I'm always worried of is like, how careful do you really need to be? I guess is the question.
Well, I think a lot of people don't know about their cycle that you can't get pregnant every single day of the month. So, it's just you have to be
Okay.
smart about it. You have to
Okay.
know your cycle.
But also, I have a fear of, so I believe in manifestation,
Mhm,
obviously.
mhm.
And I think people can will things into existence. The people I have been with in the past, they're obsessed with me.
Obviously.
So I fear, even if I'm not technically like fertile at that time, that they would will into existence a pregnancy because manifestation is powerful.
Mhm.
That's my fear. I understand the science, but also there's more than the science.
And
People are powerful.
you can get pregnant, yeah, like, technically anytime. But, yeah.
That's what I'm scared of. I think that's a valid fear as well.
But again, like you said, you don't sleep with a loser, you don't sleep with a broke man. So if it happens, it's meant to happen. I think everything happens for a reason. And then you just deal with it then. But it's not, I don't think it's,
My only thing is right now I would have to convert my Pilates studio in my house into a nursery, and that would be a bummer.
you're thinking too much into it though.
Yeah, that's like sort of the immediate. That would be like the immediate inconvenience. But, long term, obviously, I would be living in an apartment. I would have a home and all the
But
things.
if whoever you're with is trying to, you know, will into this, you can do the opposite.
This
They're
is
not any
true.
more powerful than you.
No, this is true. This is
And
true. I
you're
actually
more
didn't
in
really,
tune with everything more than a lot of people. So
especially with
you would
your
have
body.
more power than they
Okay, that's actually a good point. Now I'm less scared.
Yeah. We talked about dentistry.
Yeah, we talked about dentistry,
We
and then
should talk about gynecology.
yeah, what do you have to say about that?
Gynecology, I would have to say I don't do pap tests. Pap sh pap
Pap
schmears.
smears.
Schmears. I don't do paps. I will not do mammograms ever, ever, ever. I will do thermograms and thermograms alone. And also just a little, what do you call it? I have a little bone to pick with gynecology or just OB all around women's health. Especially having so many people around me having babies and going into emergency C-sections and everything. Why are we not like prepping women's bodies first of all, prior to getting pregnant
Yeah.
and then during pregnancy in preparation for birth?
Well, I think there's an obvious reason, which is the government wants us to die
Exactly.
and take all of our money before they kill us. So, with that being said, that's the obvious reason. I think it's just the nuances that fall within that
Yeah.
umbrella. You know what I mean?
Yeah, and they don't do research on women. Most women, I actually had this conversation the other day with a client in Kayla, our nurse, and I was just saying how it's so interesting because you could go to the hospital for something and a woman could be having a heart attack, but they present so differently than a man.
Mm-hmm.
And it's so slow to diagnose to be like, this is what's happening.
They'd be like, you have anxiety.
Yeah. Yeah, exactly. Women could be having a heart attack and the only pain they have is in their wrist and they just feel off. That's actually very common.
Oh, it's crazy. I didn't even know that.
Mhm. And so this client, her mom had PE and she never goes to the hospital or sees a doctor in general because a lot of women are just tough, don't care. They've been through a lot. And especially if you can have a baby, nothing faces you. And she just felt off. So she ended up going to the hospital. So they knew something was wrong. They tried to send her home. And then she was like, no, something's seriously wrong if she's there. And then she ends up having a literal blood clot in her lungs.
Was she okay?
Yeah, she was fine.
Okay, that's good.
Yeah.
Yeah, that's
And
horrifying.
yeah, she's now one of our clients. So women's health, it's just sad. The research, they don't do research on women. Same with kids, and they don't do because they only fund what they want to fund and what's going to make the money.
Right.
So women are just kind of neglected.
I know, which is why I also love what we do because remember that girl who came in who had POTS and she was like, this is the first time I've been to any type of a clinic, which we don't even work for. It's a med spa. It's not a clinic,
Yeah.
really. That anybody cared or listened to what I had to say and gave me actual thoughtful answers
Yeah.
to a solution. And I like almost started crying because this is so sad.
Yeah, and so many people
And
are like the
also,
same way.
we are not those
Providers,
people.
yeah.
We're just, especially me.
Mhm.
I'm just, there.
Yeah. Yeah. But I mean, we actually want a solution and we meet people where they're at. And then even if we
There.
don't know, we try to figure something out.
Right. Tell them that we don't know.
Yeah.
And then give other referrals. I started doing that. And NP, I did my blood work in my GI map with.
Mhm.
I was like, girl, we need a referral system here. I need to start getting paid because I was referring out to her so much. Because how many times a day do I hear, oh, my blood work came back normal and so I don't know what the hell to do. And I'm like, you need to see her. She's going to run the right tests. She's going to do a GI map. And then you should get on her monthly plan if you can afford it and you need that. I didn't need the hand holding. I can set my mind to it and just kind of adapt.
But not many people.
But not many people are like that. Yeah. And see, I started that because I was like, might as well make some money. I'm sending you clients literally every single day.
Yeah.
But it's so sad because it's, again, every single day and people come to us as their last resort. And I'm like, you know what? Good, but also so sad.
Well, I think the big thing is they have normalized feeling
Not being normal.
non-normal,
Yeah.
and they don't know what normal feels like until they do feel the way you actually should.
No, literally.
You should have energy. You should sleep well. Your hormones should be regulated. You should not have cramps. You should not have symptoms. You should feel good.
Every day, yeah.
And then with the blood work situation, so many like clients, patients, everyone's just like, oh, my blood work looks fine. I'm fine. But if you have symptoms, something's wrong. Also, blood work does not start to look abnormal until there's already 40% dysfunction, which is alarming. Because it's, oh, your liver looks fine. Your lipids look fine. Everything
Who
looks
came up with those numbers?
fine. Well,
The range is also, they're like, oh, if it's 0 to 2,000, it's
Exactly.
normal.
Yeah.
And you're like, what?
Vitamin
Shouldn't
D
it be a little
levels.
bit more specific than that? That's
Exactly.
crazy.
Like vitamin D levels, it's 30 to 100 is normal. When like functionally, you would want it like 60s, 70s.
Yeah, when I worked with that NP, my levels were like
Mhm.
50, high 50s. And she's like, I've never seen a woman with vitamin D levels under 75 feel good.
Yeah. Yeah.
And I was like, oh, okay. So I'm going to start that today.
Yeah.
But you wouldn't know. How would you know?
And that's the thing too, is like a lot of doctors just treat the paperwork, the lab work, what their chart rather than the actual symptoms in the patient. And also
Yeah.
everyone is so different.
Yeah. But, to doctors' credit, I am friends with a lot of doctors and know their, lives and day to day. It is crazy what people expect of them in what they need to do to keep their practices alive. So it is not like, oh, they're horrible.
They just don't have the time.
They don't have the
sit
time.
there.
And I wish that, they were compensated correctly by insurance and didn't have to fight literally every single claim with insurance so that they could just make the money they needed, see 6 patients in a day and give really quality
Right.
care. So hopefully that's something that God will bless us in the
Yeah.
future with. But it's not all their fault, but it is sort of, they're just in a lose-lose situation. They can't win.
Well, and I think that the issue that I've run into is I've tried to advocate for myself with providers, and then sometimes there's a pushback because it's like, well,
That's not what we do.
Or yeah, exactly. They're like, well, it doesn't follow. And we talk about this all the time. Not everything is cookie cutter, and sometimes they're too cookie cutter of like, well, you have this symptom or your blood pressure's this is what we prescribe. Versus we are not every person's different. We're gonna think outside the box. We're gonna come up with a solution that
Right.
best fits everyone.
Right. Or having honest conversations. I tell clients all the time, they tell me their problems, XYZ. And I'm like, this will help with some of the symptoms. It's not going to solve the problem, though. If you want to solve the problem, you need to go see the nurse practitioner and change your whole lifestyle. But they'll come in and be like, I've had back pain for however many years. And I'm like, yeah, the red light and cryo is going to help with inflammation, which will help mitigate the pain. But you need to see a physical therapist. And hey, have you ever tried working out before?
Mm-hmm. Yeah.
I'm telling these people, I'm like, then they get mad at me. And well, again, back to the lying thing.
Mm-hmm.
Hey, you need to go to the gym.
Yeah.
They're like, I don't want to do that. Okay, then cryo and red light's not gonna fix your life. So,
Yeah, nobody wants to take responsibility these days.
but also, okay, so here's the other thing too. When I was with my dentist and he told me to do the things I needed to do to have a successful implant, and I looked him in the eyes, I said, hey, guess what? I'm not gonna do that. You know what I mean? So that also happens. Was he right? We may never know.
It's up in the air. It's
We
debatable.
may never know. How could we know? But he knew what he knew. I knew what I thought I knew. We were at a standstill. Implant failed. That's okay. Whatever. But so I'm saying people should listen to me. And then I'm in the situation where someone's like, hey, you should listen to me. And I'm like, how about no? How about definitely not? So I see both sides. I'm part of the problem.
Yeah, it just depends if you've done your research or not.
I just didn't want to take antibiotics because I knew it was going to make me feel sick and shit myself.
Which is valid. Because with antibiotics, there's a high risk for a lot of secondary infections. And yeah.
And who likes shitting themselves? It's not fun.
Yeah, coming from a girl who's sensitive.
Yeah, but I just, sometimes you have to. Listen.
Yeah.
I don't know.
But the second time's a charm.
Second time's a charm.
We live and we learn.
And also, just because the first one failed doesn't mean the next ones have any higher risk of failing.
True.
So it's fine. We're going to start a new slate. I'm definitely going to pray over the implants, and I'm going to do the mouthwash because I figure,
Yeah.
let's switch it up.
It's going to work. It's going to be amazing.
Yeah, let's try something a little bit different.
You're going to have tooth.
And then I'll have a tooth, and then don't worry. If you see me facing front, you wouldn't know I didn't have a tooth. But I know that I don't have a tooth because obviously when I'm chewing, it's very inconvenient.
Yeah. Oral care.
Have you ever listened to a podcast or read anything about how people think our teeth store memories?
Yes, I am very anti getting your wisdom teeth out. And I think our other little friend, dentist friend, was telling us there's a lot of importance in like
Palate development.
Yes, palate development, making sure your kids are breathing properly,
Nasal spray.
eating not soft foods, starting them on hard foods pretty immediately rather than just all
Yeah, to
purees.
develop.
And
Why is that even a thing? Why is baby food even a thing? Because I was gnawing on chicken when I was, I think my mom said 4 or 5 months old.
yeah, I think it's a lot of fear tactic. And also the kids have to, they're going to choke, they're going to gag on things, but that's to develop. That's good. They should be choking on things.
And
At
just
least
how they're
learn
going
to
to fall down the stairs and all the things too.
Yeah. Yeah. So, which would be interesting. Maybe we could have a little like guest to talk about palate.
I don't think
Not a set guest.
I
but
don't
we
think
discuss
they're
it with-
interested in that at all,
I
actually.
think some moms would be very interested in knowing how to wean their kids.
No, I agree.
But
Totally.
we could find a specialist in the area.
Area. Okay, perfect.
I do think it's so. Also, if you think about it, then people would have need for braces.
Yeah.
We probably wouldn't have people who are snoring, sleep apnea, sinus issues. If
Yeah.
everything would just develop.
And fit in your mouth.
Yeah, and it would create more attractive people.
And that's really like our mission statement.
Yes. We want everyone to be healthy, skinny, and hot.
So this would help with that. And that's important.
Mhm.
That's important. Yeah, I've never considered that because something I like to ask dentists, this is just a dentistry podcast. I'd like to ask dentists, why are you a dentist? Here's the thing. When you were
Because they
when you were
couldn't go to med school.
15, no, literally. When you were 18, when are people deciding they want to be a dentist? 20? Because you're like, I guess 18, let's say you go to your undergrad, you got to get on the pre-dental track, right? So you got to start taking the chem, or bio, whatever the hell that you need to take. Why are they like teeth? I think I know the reason. They think they're going to work Monday through Thursday. They're not going to want to kill themselves, and they're going to make a lot of money.
Mhm.
That's not even the case. They didn't do enough research because that's not the case.
Mhm.
I mean, they do make okay money. Not all of them, though.
Well, not everyone's good either.
And why are you passionate about teeth? No one's passionate about teeth. That can't be right.
But that's a niche
Right?
specialty. Who is passionate about feet? You know, you do have
No.
fetish people.
Okay. When I was in college, I worked at a neuroscience lab at med school, and one of my lab mates, I don't know, was a what are they called? What are the feet people? The feet doctors. A
Podiatrist.
podiatrist. I almost said a periodontist. That's not it.
Right.
That's not it. A podiatrist. And I was like, you're weird.
Yeah.
You're so weird.
Mhm.
And also, I was like, I think I've said this 3 times in 45 minutes. I'm smarter than you.
Yes.
I'm like, why do you want to look at people's feet all day? It's weird. I think they're just like, I don't know what else to do.
Well, okay, going off of podiatry. Okay, so we have feet people, but why don't we don't have like hand specialists?
I think only for surgery.
It'd be like,
But okay, so all the podiatrists, I think they're 90% of their cases, I'm just saying this, I have no idea if this is true or not, are diabetics
yes,
with feet.
agreed.
You know
But
how
why
their feet
wouldn't that be
problems.
like linked in with like endocrinology?
Because why would they want a solution to the problem?
True. I mean, yeah. It's just very interesting. Like
Yeah.
that's a very limited niche area.
Also, could be wrong about this, but I'm also 99% sure he was not in medical school. He was in podiatry school.
It's a little scary. Like I
Like
feel
it,
like
right?
if
Is that a real
you
thing? Podiatry school, not
probably
med school.
yeah, be like
Because
chiropractic.
I don't think people go in their match day, they match podiatry.
That'd be intense. You would go through an intense med school just to do that. That's weird. But I guess look at dermatology. They go to med school. That's like
No, yeah. I don't we gotta do some research on how
yeah.
this works. I don't know how this works.
Yeah.
I haven't thought about this since I worked with this
Maybe
kid
we'll have some podiatrist listeners that can give
that
us
can
some
write in
insight.
and you can tell us what type of schooling you did. Um, I know my friend from college, she could be wrong, but pretty sure that girl doesn't give a shit about teeth. She's just really smart and super motivated, very competitive, and I think she was not down for the med school thing. But she was like, "I don't wanna be a nurse."
I do
So
like
dental
some
fell in the
nice teeth, you know?
and she loves nice teeth as well.
Beautiful white.
She's doing,
Veneer
she makes
veneers would
fake
be fun.
teeth.
Veneers would be fun.
I think that's what she's gonna
Yeah.
do.
Yeah.
Um, but I don't know. I don't know, I just can't imagine forcing myself to do
All sorts of special
things like that.
love
She's gonna be
cardiology.
she's gonna have a
So
lot of money, though.
yeah. I
We're
mean,
just
we need them, I guess. I guess.
You do need them because when you're born without an adult tooth, it's like, who do you call? You gotta call them. And then if my implant got fucked up, I think she would fix it.
Mhm. That's true.
I'm just
Oh.
curious how they're like, "Oh, I wanna take the the DAT, and I want to be one-on-one with patients for their teeth every day for the rest of my life." Never have I ever thought that thought.
Mhm.
I've never thought I wanted to do anything for the rest of my life, though, so I don't know.
Yeah, I mean, you have people in waste management that are doing crazy things, taking care of our waste.
But they didn't go to
So,
school and pay
mhm,
$300,000 for that.
very true.
They you know what I mean?
But the compensation is probably
Like, good.
there for yeah.
No, for sure.
I don't know, it is interesting to be inside people's brains, like, to think about where people's thought process and
Well, the
perspective
one
is.
dentist did say when I asked him, I said, "Why did you want to become a dentist?" He said he does care about oral development. We were talking about the palate development, and he's like, "I don't care about like brushing your teeth and flossing." And I was like, "That makes sense."
And sometimes it's like somebody they look up to was that, and then they decide to just do that.
Well, my other dentist friend says yes, his sister's becoming a dentist. Pretty sure, now I'm just saying things. I don't know if it's true or not. Pretty sure he told me that it was because he's a dentist. But I'm like, does she know you hate? Do you hate? I don't want to say this. This is kind of crazy, but I'm like, you hate your job, right? Does she know that? When she was gonna go to dental school, you're like, by the way, do you know I hate my job?
Does he actually hate his
No,
job?
I think he likes it.
Or is he just extra stressed? And it's
I
just
think the
bopping around the
stress
travel.
and yeah, it's Yeah, I think that's
Because
probably
we don't hate our job, but we have
love my
stressful
job.
days
Love my
where
job
it's some days we'd rather be at the beach than
every
at
day.
work. Yeah, exactly.
But that's not what
Yeah,
they're not he's not like, "Oh, I'd rather be at the beach than work." Of
it's like
course, of course. You know what? He might like his job. I don't know.
he's
I don't know.
genuinely unhappy.
I don't know. I can't that's neither here nor there. I'm not sure. My point is just how do you get there?
Yeah. Mhm.
But at the same time, if you're smart, driven, and you know that this is a direct path to having a successful life and career, and your goal is to provide for a family, that's actually noble of you. I understand and that and you're helping people.
Mhm. Yeah.
It's, that or maybe being a lawyer. Lawyers help people too,
I
but you know what I
wonder
mean? It's a little
I wonder what percentage of people, though, actually like their job. Most people probably just pick a job because it is good paying.
I always tell people, all the girls who ask me for career advice and stuff that work with us, I always tell them do not make decisions to make more money. Make decisions to go towards something you love, then you'll make money.
Yeah, and the money will come, yeah.
Because the money I was making when I graduated from college compared to now, and it's not even been that long. I'm 27 and I graduated when I was 22. Wait, yeah, 22. So it's 5 years. Is crazy. So much more.
Mhm.
And I don't know that that's the same for everybody. And I was embarrassed with the path I took because everybody else was going to dental school and doctor and PhD, like all the other people in my neuroscience program. And I was like, I like fitness. I like working out, and even my mom was like, so I paid for your neuroscience degree so that you could. She didn't actually say that to me. She's super supportive, but it was kind of the sentiment. But now it's it all tied together and it's great and it's amazing.
Mhm. Yeah.
But that's because I followed
Mhm.
the passion.
Mhm. Yeah.
And then eventually I'll obviously be a multimillionaire.
Well, it'll just come.
It'll just come
Mhm.
from the passion.
Yeah.
When you're doing God's work, you get compensated.
Mhm. I agree. And it's not for everyone. Thank God everyone's different, but, like, we see it with people we work with now doing the same job that don't have the passion and are just kind of
Well, I fire
bringing it
them.
down. Yeah.
I said, get the hell out of here. I don't want you here. Actually, at all.
Yeah, because it brings the vibe down, the clients feel it, we feel it, everyone feels it, so
It's a vibe job.
mhm.
You don't really have to know a lot, but if you can bring the right vibe, you're good.
When having the desire to learn goes a long way.
Yeah, and not thinking you know more than people, and as I literally have said 17 times, I'm like, "I'm smarter than them." But actually not having, like, a whack attitude and thinking you know more than everybody and all the things, it's so annoying.
Mhm.
Speaking of that, I have this is one of my, like, core beliefs and conversation topics that I talk about with my friends. I don't think I've ever talked about it with you, but I have this belief, and I just feel that it's true. Somebody else on a podcast was talking about it, but there are so many nurses, and I see this when I interview them, that think they are actually God.
Mhm.
They're like, I'm perfect.
Mhm.
I do the Lord's work,
Mhm.
which, hey, praise, you do. And they're like, and I'm better than you.
That's so valid. I think that a lot actually with I see people I went to nursing school with, their demeanor is just so entitled, above everyone. Nurses do like, a lot of nurses, think that they are the only nurse to ever exist.
And you're a nurse.
Yeah, and I am a nurse. It's
I
like
don't know if we've mentioned that yet.
I love my job, but I also am, like, I try to, like, stay humble because there's, so much that I don't know. But, yeah, nursing can have a bad mentality because you also get the older nurses that basically, as a nurse, a lot of times you do know more than the doctor because 'cause you're with a patient and stuff, but then you get this mentality of, "I don't need to learn, I don't need to listen, I don't need to question things." Like, it gets a little dangerous sometimes, especially in the hospital.
When you see the same thing too much
Yeah, and
and
you
you
get
start to
it.
make quick judgments
Yep,
about an
you're
outcome,
basically numb to everything, and yeah, you
that's
don't
bad.
yeah. But yeah, there is a mentality of nurses being elite, better than everyone. It's
And it's crazy because I actually remember this specific girl from high school. This is the first time the thought dawned on me. insufferable. So annoying. Mediocrely smart, for sure. Thought she was better than everybody. I remember telling my best friend from high school, literally, I'm like, she's gonna be a nurse. She went to Mizzou. I remember. She's a nurse. Everything I thought, it was all true.
It used to be such an honorable career, and it was
It is.
yes, but it's changed a lot over the years. The whole what we do has changed, how patients treat us has changed. I think maybe some of that I don't know if nurses have changed because the treatment isn't as good. Like, people used to think very, very highly of nurses, and then, like,
No,
COVID
people
happened, stuff
attack
happened.
nurses and abuse nurses like
That's
it's their job.
that's why I'm like, maybe that's where I don't know if the whole idea I don't know, but
I don't know what
nurses
it is
used to be,
either.
like, cherished and loved, and not that they're not, but it's just different. The if you asked a nurse that's been in nursing for, 40 years, they'd be like, "Oh my gosh, it's changed so much." It used to be very, I don't know, special, good
But
career.
but you know what's interesting too is when I was a recruiter, I recruited doctors and advanced practice providers, so NPs, PAs, doctors.
Mhm.
And I wasn't part of the nursing unit. I wish I was because I probably would have done better faster. Well, who knows? I fucking hated the job and I left and stuff. But anyway, the nurses were making cash. Some of them were making, I think, like 4 or 5K a week.
Mhm.
When I was recruiting and it was dying down, it was the post-COVID swing. So obviously they were
Travel
making
nursing.
just hand over fist during COVID, and then it started to slow down. When it was and it was like, hell yeah, you should be a nurse and travel and do all the things because you're gonna make so much money. Some of the nurses were making as much as the primary care physicians. Or not really, but close.
Yeah.
It was comparable, definitely as much as the NPs.
Huh. Yeah.
So I don't know that, but I'm not in the industry anymore. I could have totally swung the other way, but we were like, down with the nurses.
Yeah.
We loved them. I had a couple clients who were nurses when I was managing gyms,
Mm.
and those girls would pay me cash to do all kinds of stuff with them. That sounded sexual. That's not what I meant at all. Just like personal training. And I would help
Yeah.
them with like food and stuff. But I would charge them like 95 an hour. And they were
Yeah.
like, this was back when I was 22, by the way. I was like, perfect, let me start my little side business. And they would pay
Yeah.
because they were making just great money.
Now I feel like maybe some of it's been like the hospital changes, administration, how the hospitals treat nurses. Even for Nurses Week, it's just not the same. They aren't treating nurses the way they should be. And it's just kind of like,
Yeah. And some of the ER nurses here are making like an hour.
Mhm.
And not as
It's just
brand new grads either. But Florida also has like terrible nursing pay
yeah. Yeah.
in general. But it is interesting. And I just find that to be true in so many facets of life. They literally, nurses I've seen as like friends, interviewing coworkers. I'm like, why is it that you think you're so much better than
Yeah.
me?
Honestly, us hiring nurses, it has been
It's
such a
eye opening.
yeah. When I started hiring nurses, having to actually do interviews, I was like, why is this so hard to not because it's like you'll find somebody with skill but not the personality, or you'll find somebody with the
Hmm.
personality and not the skill. And it's like,
And also,
why?
you're trained as a nurse to use your critical thinking skills, right? Of course, because you're working in like acute environments. The girls who have spent the most time, not all of them, but a lot of them in acute care have the worst
Mm,
critical thinking skills and problem solving. Why? Why does that even make any sense? They're like, this is what the protocol says. We have to follow
mm.
exactly.
I think
Why?
nursing school has changed also over the years, and it's first of all, I mean, nurses so scared of everything.
Why
Also
are you scared of?
people are super sue happy,
Yeah.
and
But also, doctors are the one who are like really getting
they're gonna
fucked by
yeah.
lawsuits. I mean, I don't know, again, because I was looking at all of these doctors, like basically like legal history. I forget what it's called. It's like their NPB, NMPB. I don't know. Their legal history though. And they would get sued literally all the time.
Yeah.
And they're still practicing and it's totally fine. And honestly, I didn't even care.
Mhm.
I once hired a NICU doctor who had, well, who knows if he really, I don't know the situation, but he had like 8 deaths on his. thing, but he's also getting handed the sickest babies who
Yeah.
are maybe
And
literal
that
brink of
level.
death, and then their parents are pissed and gonna sue and stuff. It's like they were maybe gonna die anyway. I don't know the situations, but did not inhibit him from
Yeah.
making a ton of money. I don't know if it's different for nurses with licensing, but I'm like, you guys, I don't think
Yeah.
you're
I do think, like, in nursing school, first of all, I think nursing school does not equip you well. They're so all about the tests, and it's like, we need to focus on hands-on, like, real experiences, and it just wasn't. We couldn't even start IVs in nursing school, which is crazy. We did a simulation.
even
So
when you're your second year.
correct, yeah.
Wait, okay, but my friend who was in dental school was doing dental work her second year. And I was like, that's terrifying. You shouldn't be touching people with this. I don't know what they use,
Yeah,
the little tools.
yeah,
You shouldn't be doing that. I said, I know what you do on the weekends.
yeah,
I know what you do in your free time. No,
yeah.
that shouldn't be legal.
But it's you need to start somewhere, but, like, yeah, I did not start IVs. I started them on my mom, like, in nursing school just because, but I didn't really start doing them until I was a new nurse. They sent me to a floor that was, like, prepping people for surgeries, and I just, like, went at it and poked people. I it was horrible. Horrible. I was terrible at it. I had no experience. Also, I'm putting IVs in people who have horrible veins, had chemo,
Yeah,
dialysis, all these things, so
probably
their veins
so
are
dehydrated.
garbage. Um, but also in nursing school, it just does not equip you for real. Nothing's realistic. Like you said, it's all about tests. Anyone can test well and be a horrible hands-on, or vice versa. You could test horribly and be amazing hands-on. It's like, what do you want? You want somebody who's amazing hands-on. Yes, you need
Hmm.
to know your stuff,
Yeah,
but like the more hands-on you do things, you learn more. And I feel like the dynamic or the way nursing school is set up is literally for failure. So then people get through nursing school who shouldn't be making it.
yeah, and then they're getting hired.
Yeah. And then you have a bunch of miserable people, and it's just like, oh, you think that like doctors, nurses, firefighter, all these people when you're younger, you just think they are kind of God. Like you're like,
Yeah,
they make me
they know,
perfect.
they
I know.
know.
Like
Yeah,
they're just so perfect. Like how you see your parents. And then you get to that point, you're like, actually, nobody really knows what they're doing.
at
We're just
all.
all living life for the first time,
Yeah,
figuring it
exactly.
out, and it's just scary.
And it's scary. Yeah, it's very scary. Because who are you supposed to trust? Like, how do you know how to ask the right questions? I started to get to the point with like providers where I would ask questions. I don't know if it's the right question, whatever, but based on their response, I was looking for types of responses. What type of a solution are you looking for? Or do you just tell me a generic answer? I picked my dentist because I liked the way he explained how he does things because I was like, "Oh, okay, you're actually using your brain and thinking."
Mhm.
But a lot of doctors are just like, "This is the way we do it. This is the procedure. This is how it's done, and that's over." And I'm like, "Yeah, but I also know that every body is different. Like, I want to know that you are thinking about me as an
Yeah.
individual."
Yeah.
So then I'm like, "Well, that's the best I can do."
Yeah.
Is that you're gonna try and you're gonna think really hard. You're not just gonna be like, "Well, it is what it is." So
Yeah, you kinda need, like, a vibe check from everyone.
definitely a
Like, you can
vibe check,
tell. You can
and that's
tell.
how I do hiring too. If the vibe is there, you're hired.
But some people are manipulative, or give them a little bit too much of the benefit of the doubt, and then we
I
get
don't like to
burned,
I don't
but
give the benefit of the doubt. I like to fire everybody immediately if I don't like them.
that's why we're gonna try to do working interviews.
And that's the smartest thing. You can't go into that
Yes.
because
Yeah.
I'm not sure if that's
Well, it's just like a little
allowed.
shadow, a little
It's
shadow.
okay, a shadow is different. It totally.
To see for an hour of time how you interact with clients
And
and
how can
people.
you handle me telling you what to do all day? Because when you're training, obviously that's what it is. If you can't tolerate me speaking literally just how I talk
Mhm.
to tell you what to do, you can't work here.
Yeah, people are gonna start crying when you ask them if they did their modules, and you're just
No.
like,
No,
tears.
not me saying, "Hey, why didn't you prepare for the training we paid for? Hey, do you know we have to pay to get you trained to be a esthetician? Why didn't you prepare for that?" And then you lie to me, and you tell me no one told you to prepare, and then you start crying. Yeah, you're getting fired. Obviously. You think you can keep your job after that? Uh,
Dog
they need
fight.
to control
Oh,
their
it's
dog
it's
or
our
the
German
German Shepherd.
Shepherd, yeah.
Of course, it's a little yappy white dog too that's being mean to the German Shepherd.
How rude.
How rude.
Okay, do we wrap this up?